Get informed. Get educated. It's all about your health. This is Healthy Living with Dr. Lateef Akinola.
Hello, I am Dr. Lateef Akinola, consultant obstetrician and gynecologist working at the Medicine Specialist Women's Hospital, Lekki, Lagos. This is our next episode of Healthy Living podcast series. And today we have Mr. Johan Kruger from South Africa, Johannesburg specifically, is visiting our hospital today to install artificial intelligence capability in our IVF laboratory. Mr. Johan Kruger, you are welcome. Could you kindly give us a little bit background of yourself, please?
Yes, thank you, doctor. Thank you. Yes, so like the doctor mentioned, my name is Johan from South Africa. Our company is based out in South Africa. It's called Vitruvian Medical Diagnostics. And we specialize in medical diagnostics. The product that we're implementing here in Nigeria at the moment is specifically in the IVF space, looking at sperm selection. And just a little bit of background about my company and myself. So software engineering background and also developing software for the last 15 years. Our company specializes in developing AI software. We have a couple of modules. The one that we're discussing today looks at sperm selection in the IVF process. That's basically the background and the company.
Thank you so much, Mr. Johan. It is an open knowledge now that artificial intelligence has revolutionized majority of human endeavors. Assisted reproductive technology is not left out. The traditional methods of assessing sperm, human eggs, oocytes, embryos are prone with errors from inter-observer variability, and also they are laborious, and the results are often not comparable from one individual to the other, or even, from the same individual. But with artificial intelligence, we now have an objective process that is streamlined, that is scalable, and that is reproducible amongst all IVF centers. This has given us the impetus to improve the success rates and outcomes of our treatment modalities. Today, we are going to look into the indications, the downside of using artificial intelligence in assisted reproductive technology. We are also going to look into the future of artificial intelligence in assisted reproductive technology. Thank you, Mr. Johan. Could you kindly give us a little bit about what is artificial intelligence?
Yeah, so artificial intelligence, there's a couple of kinds. Most people out there, when you say artificial intelligence, they think about ChatGPT, which uses large language models. But there's actually different aspects. You can get artificial intelligence that uses large language models, which is a database of text. And it actually gives you answers based on the text that it has and that it's been trained on. You also get artificial intelligence that's based upon imaging. So you can have it look at something and start recognizing patterns. And you also get AI that looks at audio, which can listen to certain things and derive and transcript and do things based off of that. So basically, in a nutshell, AI is humans teaching computers, giving it enough information and teaching computers to do things that we do.
Okay, so how does this help us in assisted reproductive technology? What are the implications or indications in assisted?
So one of the things that happens in assisted reproductivity is that you have to recognize patterns. You have to look at sperm, look at the morphology of them. In some cases, when you run chemical tests, it will give you indications of fragmentation. So there's a lot of pattern recognition that needs to happen. And by using software that utilizes AI, you can outsource that to a computer system. And what that does is if it has enough data that it's been trained on and it knows what it's looking at, it can standardize all of your processes for you, and the outputs can be consistent. So an example is if you had to get 10 embryologists to look at a sperm and give you an indication based off something that whether it's fragmented or not. Each one might give a different answer. But if I give the same 10 sperm to an AI, it will give the same answer across them. So it definitely standardizes output in terms of that.
So your company, VMD, so when do they come into this market space?
So about 4 years ago, when we initially started the startup, so it basically the idea was around we always knew we wanted to do diagnostics assistance. We started off in the heme space, looking at malaria, and that's how we ended up developing our own camera, because we knew that we had to maybe take rural labs that doesn't have digitized microscopes and those kinds of things, and be able to digitize the data that comes out of that, so that we can start training models based on the data. And that was the initial starting point. And then from that, as we got into the lab space and we got exposed to all of the different types of labs that's out there, we obviously met with fertility labs, and we started to understand the problem that's there as well, where the low success rates that you get with IVF and ICSI and the expense that goes along with that. And we felt that if we can introduce something similar that allows you to go and make predictions based off of data, and as the more it becomes accessible, the cheaper it can become, that would be beneficial for all people in the IVF space.
So we've been inundated with the advantages of using artificial intelligence in assisted reproductive technology. Are there downsides?
Yeah, so I mean, I can kick it off by saying that it's not a silver bullet yet. We cannot guarantee pregnancy. So obviously there's still a lot of aspects that goes into it. It's not only sperm selection. There's the health of the donor and the eggs and all of those things, the parents, and there's a lot of stuff that goes into there that actually makes up a pregnancy. But other things that makes it a little bit different is it is quite data intensive. So you have to collect a whole lot of data in order to get a model that predicts accurately. And then also I would say regulation is quite a big hurdle in terms of getting a technology like that into the space, because obviously you're dealing with humans and lives, and you can't just be selling any product that's not been regulated and validated. So sometimes it's a long process to get certain modules validated. You have to go through trials and proof, and that takes some time.
So after deciding on a model, and then you take it out for trials.
Yeah.
So, and then how do you validate it? Making it to be usable.
Yeah. So the
laboratories.
So the standard procedure would be is we would partner with one or two labs, and we would go through a data collection process. If the data is not readily available, like in the case of sperm selection, data wasn't that readily available because people don't just take images of sperm in the lab. They mostly capture images of, let's say, oocytes for oocyte grading and those kind of things. So that would be a module where there might be data readily available already. But if you've gone past the stage of collecting data, then you would train a model. And then that model would then be put against other outcomes. So let's say, for instance, you have 10 patients or 100 patients, however big your validation needs to be. And then those patients would be tested with in-lab existing tests, and their results would be made available. And then it would be tested with the AI, and those results needs to be compared and it needs to be within certain ranges to be acceptable.
Do you have regulatory authorities in South Africa that regulates all these artificial intelligence applications?
So not specifically. So we have SAPRA in South Africa, which regulates medical devices. It is known that artificial intelligence or medical software systems, in conjunction with a medical device, so let's say the camera that we attach to the microscope, is seen as a medical device. So it is being governed by that, but the policies are not very clear yet on that. So it's still being developed. We have also engaged with some other organizations like the FDA and like CE in Europe, which do have a lot more developed in terms of policies and procedures and how things need to happen. And yeah, it's that's why I mentioned regulatory it's definitely necessary, but it slows down certain things, which is necessary because you have to keep the patients in mind.
Yes, I quite agree with you entirely, because there has to be regulation. Anybody cannot just put any software out there. So my software is fantastic, artificial intelligence integrated and can do this lots. Then there's no proof that it's doing that. There has to be regulations, strict regulations, so that we don't mislead ourselves and our patients. Now, apart from, what is the name of your software? Do you have a name for it?
So yes, we call it VitaMD. So so it just speaks to the fertility health, that's what.
Does it cover other aspects apart from sperm? Does it cover oocytes?
So at the moment, the focus is male fertility, and what's included in there is we look at motility, we look at fragmentation, and we also look at morphology of the sperm, and then we use all three of those inputs to make better decisions based on what sperm is the healthiest. Oocytes is definitely something that's in our crosshairs that we're looking at, because we know the more of these points that you can bring in and get clarity and standardization on, the more objective your decision making can be, which will eventually lead to better success rates.
Okay. Yeah. Now, apart from assessment of sperm, oocytes, and embryos, there's also an aspect of IVF that is very important. Pre-implantation genetic test.
Yeah.
Okay. So do you have any plan in future to inculcate that or integrate that into your system?
Yeah. So not immediate plans to incorporate that. Genetic testing is obviously on a molecular level, where we are solely looking at imaging now, so what we can see with our eye and what we can train the machine on. But if we ever get to a point where we can use the output of those kinds of tests as an input into our decision making process, that would definitely be something that we would look at.
Okay, so we've always been warned that, look, ChatGPT, as we mentioned, is available on mobile phones, on computers, and almost, every technological application. But we've been warned that artificial intelligence, AI, can also, is prone to errors.
Yeah.
So how do you guarantee your Vital MD software against errors?
Yeah, so obviously the obvious thing is you need to give it enough data to train it, right? It's like asking a similar question: how do you prevent your embryologists from making errors, right? So there are going to be intra-expert variances. There are going to be, so you are going to get these deviances. But what you want to do, I don't think you'll easily be able to get it to a point where if it tells you A, it's 100% A, right? There will always be a little bit of a variance there. But what you want to do is to give it as much data as you possibly can, run as many trials and validations as you possibly can to get to the place where you feel comfortable that the level of accuracy that it has is acceptable for your lab and for what you're doing.
What percentage of accuracy do you agree to be acceptable, please?
So we, in most of our modules, we go and find out what is the acceptable percentage in that field. So let's say when we go and speak to professionals and we say, okay, when you have 2 or 3 embryologists looking at sperm, what are the inter-expert variances and all of that? And then we try and base it off of that. But it's usually, if I have to give you a number, it's usually high 80s, 90% that you have to be accurate for this to, and in most cases, or in some cases, we also get guidelines from WHO that says it needs to be, you need to be this accurate, and then we stick to those.
Okay, thank you. Now, Mr. Johan is in medicine's IVF lab, and is here to install its company's software into our system. We have an ICSI rig that we use for fertilization of oocytes, and it's going to install this on our computer in the laboratory so that we can use its software to, count sperm. We can use it to assess motility, and then we can use it to assess DNA fragmentation so that we can be able to select, accurately a competent sperm that will improve our outcome of IVF treatments. Now, what are the things, if you hear now, what are the things you wish we could have that could help us in software apart from computer?
All right, yeah. So apart from the computer,
Hardwares.
Yeah. So hardware. So what you need for hardware for the system to work is you need an ICSI microscope, set up with 20x and 40x oculars, so that you can do 20x for motility and you can do 40x for the DFI fragmentation. The reason for the 40x DFI fragmentation is that we need to see some level of detail on the sperm that is not actually visible on the 20x at the moment for us. So you need to be able to see that in large. Then you either need one of our cameras that we can provide you. We've developed a very low cost camera that can attach onto the trinocular attachment of the ICSI camera. Or we are busy integrating with a whole range of existing cameras that's already being used on ICSI cameras. An Octax is for instance from Vitruvian is one of the examples. So once you have the microscope, you have the camera set up, you have the software running, you are ready to start analyzing. As simple as that.
As simple as that. Yeah, that's great. We've had it installed on our system, and we have used it. We are still assessing it, and hopefully it's going to be something we will integrate into our system. Now, what are the financial implications of using your software?
Yeah, so financial implications, you're looking at, I'd say around 2 to 2.5% of the total IVF cost to make use of this module, which if you look at it in the total costs, from a total cost point of view, it's actually not that much. But we also look at creating tiered or bundled packages, where if you know that your lab is doing a specific amount of cycles in a year or in a month, we can always cater that specific to that and give you a fixed amount for that. And then obviously we are definitely giving reduced costs to African labs, because we want to expand further into Africa to make sure that we can help wherever we can.
So Mr. Johan is here in Nigeria to introduce his company software to our IVF laboratories, and he will be visiting some of the IVF clinics that are already looking forward to receiving and get his software installed in their system. Now, Mr. Johan, looking at the future, right now you have only sperm analysis built into your model. Now, is there a timeline that you're going to give us to have oocytes and embryo integrated
Yes.
into the system?
Yeah. So looking at the future, specifically for fertility AI at Vitruvian, we are definitely going to expand beyond sperm. We're in the process of perfecting it for sperm and getting it to a point where we're absolutely robust and happy with that. And then we're already looking at oocytes. So like I've mentioned earlier in the chat, we are partnering with labs where we're collecting oocyte data that's existing. So it cuts out a step there for us. So at least we don't have to go through the process of collecting the data. And then we can immediately go into training and validation, which we plan to do in the next couple of months. So definitely in the next couple of months, we will, if you're willing, reach out to you to be a pilot on one of those modules where we can run some validations and tests. And then even beyond that, to start looking at having multi-models where these models kind of feed into each other. So let's say, for instance, the sperm model takes inputs from the oocyte model, and that helps it make decisions going down the line, or it takes inputs from patient data, age, and those kinds of things, because all of these things matter when you do this. So yeah, having that, and then the big goal is obviously to get to like a global standard where everybody makes use of the AI in one standardized way, and the expected output is known.
Okay. Yeah. Thanks. How many labs in South Africa are using your software?
So currently, keeping in mind that we have gone through final validations with our university in the last couple of months, 6 or 8 months. So since then, we've implemented at 3 labs in South Africa. We ran the validation with one of the major universities in South Africa. We are busy setting up pilots in Portugal and UK, in conversations with them. We have a couple of labs in Saudi Arabia that's already using our software. And then obviously we're here now in Nigeria, hoping to expand the footprint over here as well.
Okay, thank you. I know that a lot of medical systems are being automated now. And there are fears that, artificial intelligence is going to send all the doctors and nurses away to go and find some other things to do. Do you think in future, automation in assisted reproductive technology will make human redundant?
So my opinion at the moment is no, because our drive is not to replace humans and not to take away their jobs. Our drive is to build assistive technology where you can go and use the technology to make your own day-to-day tasks quicker and better and more accurate, which means at the end of the day, the technology will help you do your job better and make you look better and not replace you completely. It's this, I had the same concern. I mean, being a software developer and looking at ChatGPT and the code that it can write, it always concerns me as well. But I mean, thinking about if you work with it, it can help you write code faster or do stuff better. Rather looking at it from that perspective gives me a sense of peace rather than thinking it's going to take over.
So there you go. So we hear from Mr. Johan, who is information technologist, and he works with artificial intelligence. He's reassured most of our embryologists, our physicians, fertility doctors that look, automation in IVF, in assisted reproductive technology, the goal is not to replace humans, that will still be in control. So there is no fear. It's just that this software system is coming to improve our success rates in assisted reproductive technology. Thank you, Mr. Johan Kruger, for coming, and we wish you safe journey back to South Africa. Our audience, thank you for listening. This is another episode that we are bringing to educate majority of our listeners about the influence of artificial intelligence in assisted reproductive technology outcomes. Thank you for listening. We'll come your way next time. Bye for now.